Everything you need to know before buying an oxygen concentrator for home. A scarcity of cylinders has also pushed concentrator market earlier a supplementary medical equipment at the forefront for home isolated patients and moderate patients in hospitals. But using the correct specification is important. On April 28, the Government of India announced it will procure 1 lakh oxygen concentrators and distribute in high burden states as an alternative to depleting resources of liquid medical oxygen. A scarcity of cylinders has also pushed concentrator market earlier a supplementary medical equipment at the forefront for home isolated patients and moderate patients in hospitals. But using the correct specification is important. Concentrators are suitable for whom? Only mild to moderately ill patients who have oxygen saturation level between 90 to 94 should depend on oxygen concentrator and can use it at home. Because there is scarcity of oxygen, even those with oxygen level as low as 85 can opt for one. Anyone with oxygen saturation depleting below 80 to 85 may need higher flow of oxygen and will have to switch to cylinder or liquid medical oxygen supply. Say if a person oxygen saturation is 87 to 90, he is put on an oxygen concentrator. If the oxygen saturation rises and maintains between 92 and 94, that means the concentrator is able to help. But if patient's oxygen saturation continues to deplete, that means he will need to switch to a cylinder with higher oxygen flow or get hospitalized, physician Dr. Sahid Barme says. Where to get oxygen concentrators online? Also, steady electricity supply is a must. So, if you live in a place with frequent power cuts, you may want to look for oxygen cylinder. Types of concentrators. There are two types, continuous flow and pulse dose. Continuous flow oxygen will provide the same flow of oxygen every minute unless it's turned off, irrespective of whether patient is breathing it or not. While pulse dose oxygen concentrator detects breathing pattern and dispense oxygen when it detects inhalation. The oxygen dispensed per minute will vary in second case. So, what to check when renting or buying one? First, let's understand how oxygen supply works. Barmes says normal air will have 21% oxygen. Concentrator will suck in atmospheric air, filter nitrogen and other gases, and compress remaining oxygen and dispense it through cannula. If 1 liter oxygen is provided to patient through concentrator, the oxygen percentage in lungs rises to 24%. With 2 liter it rises to 28% and with 10 liters it rises to 60%. Depending on need, the liters of oxygen per minute have to be regulated, Barmes explains. A physician's advice is necessary to decide how many liters per minute of oxygen is required. A pulse oximeter should be handy. Oxygen concentrators can supply between zero point 0.1 liters per minute to 5 to 10 LMP. A concentrator has 90 to 95% pure oxygen. Mohammad Ashraf, a supplier, says it depends on number of sieves filters in concentrators that affect its oxygen quality output. The purer the oxygen output, the better its result in improving oxygen saturation level in patient. A concentrator's output is not measured by its weight, it is measured by LMP output. If concentrator gets overheated, output of oxygen purity will reduce. So patient must use only as much oxygen as needed, not an overdose. A light device weight less than 27 kg. It is recommended. Oxygen concentrators are available as 3, 5, 8 and 10 LMP units. Most common is 3 or 5 LMP. A 10 LMP can be used for 2 patients who have low oxygen requirement. A 5 LMP will cost 40,000 to 60,000 and a 10 LMP can cost rupees 1.60 lakh. Sunil Khurana, CEO MD of Domestic Manufacturers VPL Medical Technologies, said it is common practice in China for those aged over 65 years to keep a concentrator at home. Khurana said 3 LMPs are ideal for mild to moderate patients. Oxygen concentrator is a home care product and ideally not a hospital product. In desperate situation, it is used in hospitals. In my understanding, in 95% cases, 3 to 5 LMP capacity is most ideal with approximately 90% oxygen purity. Khurana added that a poor quality concentrator can give poor output even if specifications are 10 LMP. So check the supplier's credential. List of importers and manufacturers in India: Philips, BPL Medical Technologies Limited, Invacare, Airceps Corporation, SS Technologies, OSORP Global Private, Medtronic, Iongen, Nidec Medical, Chart Industries are common importers and manufacturers in India. Thank you.